When one talks about the India-US strategic relationship, it is really all-encompassing. One of the areas that both countries are looking very closely at and have been focusing on for some time is healthcare. We have a wonderful guest with us, Dr. Atul Gawande. He's somebody he's a surgeon. He speaks passionately about healthcare, but he's also the USAID Assistant Administrator for Global Health. USAID is huge. I was told you have 100 offices around the world, 80 of which actually have people over there. So it's great to have you here in India and talk with us as well. I think a lot of the key buzzword across fields, of course, is artificial intelligence. And when it comes to healthcare, AI and early stage detection of cancers and other illnesses is so important. Where is the technology and how does the partnership actually encompass some of this?
Well, artificial intelligence is something that you can imagine it's going to replace my doctor, I will have a machine taking care of me. That is not what we are seeing. What we're seeing is that AI won't replace doctors, but a doctor who does not know how to use AI will be replaced by someone who is a physician or other clinician who uses AI. So as an example, we are a partner with India in developing global solutions for health. That's leading global health at USAID. That's my principal role. And one of the things that's been developed here is chest x-ray systems that can be read by an AI immediately. So a primary healthcare nurse or physician has access to specialized capability at the very front line. And that can result in faster, earlier detection of tuberculosis, one of our biggest killers. And so we're already helping deploy, having tested here AI-based chest x-ray reading, now deploying it in multiple countries around the world.
And just in terms of the technology itself, how reliable is it? And what really is the future when it comes to AI and healthcare specific to early stage detection beyond just x-rays?
Well, the reliability of AI is constantly changing as the data sets that are used to build an artificial intelligence solution. So all of that's to say, this is a difficult problem if you're a regulator. When you check that a detection system, let's say, you can also have skin checks with AI. The knowledge base is constantly changing. The AI may be getting better, it may be getting worse. And we're still developing the ways. How do you regulate something that's changing every day as it gets smarter? And so we have to develop new ways of approaching this. And that's in fact another relationship we have here, is working with the regulators. How do we teach the world to track and follow and assure the quality of these systems? They're often trained on populations that may not be within India, or it may be trained in an Indian population. Will it apply if we bring it to Africa or to the United States?
India is a global leader when it comes to the manufacture of vaccines. We've just gone through one awful pandemic, and there is always the concern that if there is something else that happens, then perhaps countries like India would have a real role in ramping up vaccine manufacture. How important is that from a global health standpoint, India's manufacturing capabilities, and perhaps some of the technology and best practices and new discoveries in vaccines which America brings in?
So India's capacity for vaccines has now become the most important manufacturing base in the world for vaccines. When India had Delta come and needed to focus all the vaccines on the needs of India, that affected the entire world. So the supply chain of Indian vaccines means that we need the capacity not only to make sure that it's serving India, but that it can serve the entire world, even in a crisis. And so part of what's been powerful is, first of all, there are new vaccines. USAID has partnered with Indian manufacturers to develop the first low-cost malaria vaccine, which we're about to roll out. Huge deal. But then there is partnerships between some Indian manufacturers enabling factories in other parts of the world, including in Africa. And so there's a global supply chain that India is becoming very important in providing.
Antibiotics is an area which is of huge concern. It's extremely expensive, as I understand it, to develop new generations of antibiotics. But here in India and in other parts of the world as well, We've got superbugs, often hospital-borne superbugs. I lost my own father many years back to a hospital-borne superbug. And the sense is that there are only so many antibiotic options which are available. What stops the further development of a new generation of antibiotics at the pace at which it's required?
Vishnu, I can't stop without saying I'm so sorry about your father. I mean, this is the story of millions of people who pick up, especially in hospitals, resistant infections. And, you know, yes, it's really important to develop new antibiotics, but we're chasing ourselves if we don't have proper management to avoid those infections in the first place. So the first priority that we work on together in India and across the world is improving hygiene in the hospitals, infection prevention and control, appropriate protective equipment so that we can reduce the number of infections that occur. Second, using the antibiotics in an appropriate way. You know, many people, including here in India, will get an antibiotic and immediately stop it when you feel better. But now that's how you create a resistant infection. You have to take the full course. Yeah. And that's like, if I had one message, that's the number one thing. If you're asked to take an antibiotic for 2 weeks, take the antibiotic for 2 weeks. The third is the development of new antibiotics. And there are new antibiotics developed for TB, for example. One called bedaquiline has become a very important drug for drug-resistant infection. It saves lives, and now is being manufactured at lower cost in India and becoming widely available. But it has to be used properly so we don't end up making resistance to that. And then the next generation of antibiotics, we have to continue to develop them. That is important.
One of the biggest concerns anywhere in the world, certainly in India, is air pollution. A few years back, when we did program after program on air pollution and how it was impacting us, there was never any statistic to actually say air pollution has resulted in X number of deaths. Now there is. From around the world, Lancet has come out with a survey, among many other organizations. Again, when you look at the partnership between America and India in healthcare, how important is it to address the potential impact of air pollution on lives?
This is fundamental. 25% of deaths that occur prematurely will be because of environmental reasons that need policy and solutions. And the biggest one is air pollution, which causes lung problems, but also causes increases in heart disease and heart attacks. When you see the air pollution index go up, you see immediately heart attacks show up in the hospitals. So this is more than 5 million deaths a year out of the 50 million deaths a year just from air pollution.
Yeah.
Another one is lead poisoning. In middle-income countries around the world, it is a major source of deaths as well. In India alone, we see that it's a source of more than 200,000 deaths in the country. Across the world, we think it's upwards of 1.5 million. So how do we address lead poisoning? Well, it's in paint, it's in spices, it can be added, you can recognize it from poor disposal of lead acid batteries from cars and other things. And so solutions to addressing air quality and lead toxicity are really essential.
And it's not just about lives, which are obviously the most important, but it's also about the economic standing of a nation. If a country loses an X percentage of people every year to air pollution, then that percentage of your potential economic growth gets affected. So it's the way of life. It's all about the way of life for an entire nation in a sense.
You put your finger on it. When life expectancy is shortened because we don't have adequate public health, adequate health care, the result is that you are shortening the number of people who live to be productive in their lives. India has 25% of deaths occurring in people under the age of 50. Yes. And so when you lose 25% of your population before they can contribute to the whole society, you lose your family member. It's a moral failure, but it's also economic failure.
Yeah. And a final question, building on so many of the themes that we've just spoken about. Indians are predisposed genetically to illnesses such as diabetes, other healthcare concerns as well, heart ailments. And therefore, if you have air pollution come in the way or some other larger macro concerns, then we are in a sense much more vulnerable perhaps than people in other parts of the world. Is that right?
There is increased risk for Indians of cardiovascular diseases and diabetes. And yes, the ways that environmental conditions, both air pollution and actually lead poisoning is a major driver. The risk of a high lead level is as much as smoking or cholesterol. For heart disease. So the combination of these two factors we know are major issues around the world, and they're neglected. We have done, we're doing important work addressing tuberculosis, HIV, malaria, addressing, maternal and child immunization and care. But we will be held back if we don't also address the environmental health component.
It's wonderful speaking to you. Thank you very much for being with us. Dr. Atul Gawande telling us a little bit about so much AI and the benefits of AI in early stage detection of illnesses, the need for new antibiotics while ensuring that antibiotics that exist now are regulated in their usage, air pollution and all that it encompasses for the lifestyles, for the healthcare of millions, billions in fact, around the world.